finish muscles and move on to nerves. And the muscles we have to do are the posterior compartment of the forearm. So when you study the posterior compartment, kind of like the anterior compartment, there are things that all the muscles have in common. Namely, they all originate from the lateral epicondyle, for the most part. And they also have the same innervation, radial nerve. So, condyles. And that's basically what they all have in common. And, well, I already taught one of the muscles that's supposed to be in this compartment. Remember, a supinator is a part of this compartment. I already taught it. But there are others. There's 9 others that are your study list. And I will think of these other 9 muscles in groups of 3. There are 3 radialis muscles. There's 3 that move the thumb, the pollicis. And there's, well, I don't know, 3, they extend wrist and digits. So there's 9, and they're, well, let's just kind of start going through. The first group of 3, the 3 radialis muscles. So that tells you which part of the forearm on the posterior side they're on, the radial side or the ulnar side. For example, you have brachioradialis. So this muscle is always misnamed by students. It's a tough one for you to remember, the name, brachioradialis. I've seen all variations of that. The most common one is radiobrachialis, and I almost regret saying it because I put it out there. Don't put radiobrachialis. It's the most common misidentification. It's brachioradialis. This muscle is named for, its attachments. Brachial arm, radialis, the radius bone. And it always goes from origin to insertion. So if you remember it that way, you won't reverse it. Don't reverse it, it's incorrect. This is the origin. This is the insertion. So, the origin, this one originates a little bit superior to the lateral epicondyle. And it's going to insert distal radius by the styloid process of the radius. So on my little drawing here, I have to orient myself. This is a posterior view. I recognize this big knob here That's the medial epicondyle. What really told me which bone is which, this is the olecranon. So which bone is this? If it's the olecranon up here. If this is the ulna, then what this bone? This is the radius. That makes this the lateral epicondyle. So this muscle originates a little bit superior to it, right up here. And it inserts styloid process, lateral aspect of the bone, right down here. So it's pretty simple, from point A to point B. It's a long muscle. It's going to go all the way from there to there. So this first one here is the Brachioradialis. They call it the root beer drinking muscle, or just beer drinking muscle. I remember a thing my anatomy instructor said that's kind of funny, ha ha ha. But what do you really mean by that? When you grab a mug or a cup, what is this? Is this pronation or supination? Well, it's kind of neither, isn't it? This is supination, this is pronation. So what is it in between? Mid. So they call this mid-pronation. That's what this muscle does. It flexes elbow, but in mid-pronation. That's its main action. Like as in drinking root beer, or drinking anything. Flex, mid, pronation. A hammer motion. You know, do mid pronation, and you do hammer curls in the gym. Or a hammer curl is different from a regular curl where you're fully supinated and you curl. The hammer curls, you have dumbbells and you go like this, and it's different. You're using this muscle more when you flex in mid pronation. Now, when you look at this app, they usually don't show that. They usually just show the regular flexion without the mid pronation. But that's usually what we say. Flex mid pronation. Let me rewrite that. Flex what? You tell me. What's the joint that's flexing? The elbow is flexing. Now, what region is this? You would say forearm. So you could say flex forearm or flex elbow mid pronation. That's always the best way to put it. Flex elbow mid pronation. That's the main thing. You know, this muscle, it's kind of like most textbooks won't say it. It can pronate or supinate. Because it's kind of like right in the middle, so it can kind of do either. I won't write that on the board. Most books usually don't even say it. But remember, this muscle inserts on what bone? Yeah, so it can affect pronation and supination, kind of both. This is kind of an exception muscle. Most muscles in this compartment extend. This one doesn't. It flexes. Okay, so it's kind of the exception muscle. But I'll kind of put in parentheses, secondary action, pronation, supination. It's the first muscle you should look for when you study this compartment. This muscle is the most misidentified muscle because it's the border muscle. You have all these muscles on the front, the anterior compartment. Then you try to go to the back, and this is it's like the first one you see. It's kind of like halfway in between, okay, before you study the rest of them. So be able to identify this muscle first before you try to identify anything else on the forearm, I would say. Practice it the most. When I grade any exam, Some of them that I put on there, I'm like, oh, if they get that one, it's kind of a harbinger on how you did on the rest of the exam. Oh, they got that one. Usually they get an A or a B. This is one of those muscles. You figured that one out. It's like the key to like the rest of the region. You tend to do well in the entire test. And so are these next two muscles, because it's like they're hard to remember. There's 4 words in the name. Extensor Carpi Radialis Longus. This muscle is named for, what it can do. It can extend wrist, right? It can extend wrist. So it is named for its action. It's also named for the region it's located, right? It's located on the radialis side in the posterior compartment of the forearm. The last term is a relative term, something that is long. This muscle is longer than some other muscle. There's a brevis that we have to know. It's the next muscle. So you have to put it in the correct order. Extensor, carpi, radialis, longus. So all 4 words and in the correct order. Okay, and you get full credit for IDing that one. And it's the same in terms of attachments, basically. Originates pretty much lateral epicondyle. Okay, this one is going to insert the base of the second metacarpal, but now we're on the dorsal side, right? Because we're in the extensor compartment. So, lateral epicondyle. Right up there, lateral epicondyle, right? And it's going to insert base of second metacarpal, boom, right around there. It's a long, slender muscle. It's going to run from point A to point B, like before. Extensor carpi radialis longus. Next muscle, extensor carpi radialis brevis. Let's write it all out again, because I think you need to practice. Extensor extensor carpi radialis brevis. So this is the shorter one. Usually the rule in anatomy is if you have a longus and a brevis right next to each other, the brevis muscle is shorter and it's deeper. Okay. So like for example, it's hard to show here, but let's say that's my joint. There's one muscle crossing the joint. And here's another muscle. Well, which one's the longest? Well, obviously the one that's longer. Now, why is it longer? Why does it have to be longer to be more superficial? Well, if it's on top, it's pretty much going to be longer. Okay. So brevis muscles are usually shorter and deeper. Longest muscles are, well, they're more superficial and they're longer. Okay, so I'm trying to give you rules so you don't misidentify these two. Okay, this one's a little longer and this one's a little shorter, but they both do the same thing. They both extend the wrist. Now, again, I didn't write that. So if I said, you know, name a function, name an action of this muscle, extend wrist. Okay, it's pretty easy. But this one, the origin will stay the same. The lateral epicondyle. And the insertion is base of third metacarpal. So that's the one right next to it, right here. That's the insertion. Did that first. And here's the origin way up here. And just draw the muscle going from one point to the next, from origin to insertion. So what I've done is I've drawn all three muscles separately. Right, we started with identify on your notes. Brachioradialis. And then extensor radialis longus and extensor radialis brevis. And when you look for them on the models together, name them in that order. Okay? So let's go to a posterior view. Let's zoom in a little bit on the forearm region. And I guess we did this side. The right side. Throw on all the layers. This is the back. That's the brachioradialis muscle. It's considered a muscle that's part of the posterior compartment, although it's difficult to view from the posterior compartment. Let's look at the main action, elbow flexion. However, I would want you to say elbow flexion, mid-pronation. They're not really showing that there. That's it, that's elbow flexion. The other two we talked about are not flexors, they're extensors of the wrist. Anyways, and just identifying them, I'm going to really zoom in. That's brachioradialis. Therefore, if you go in order, that muscle is extensor radialis longus, extensor radialis brevis. So it's hard to get a sense of the anatomy looking at in a presentation because the muscles are very slender and they're just right next to each other. So you just have to practice on models. I think that's the best way for you to master them. Well, for example, you know, this muscle, these muscles. Let me talk about brachioradialis for a second. And I gave you its insertion. Let me isolate. Here's the question. Does brachioradialis cross the wrist joint? Yes or no? Does it cross the wrist? No, it doesn't. If you insert on the radius, you can't do this. You can't move the wrist if you insert before it. And I didn't give you that as an action. And brachioradialis cannot affect wrist flexion or extension. Now, let me ask you the other one. Well, the other one, I think it's a little bit more obvious. Like this one. Without even knowing which one it is. Does it cross the wrist? And first of all, you're asking, what do you mean wrist? What's the wrist in anatomy? I would say it's right here. That's the wrist, because these are the carpals. Okay, there's distal ulnar radius. This tendon is crossing. Now this insertion is the base of the second metacarpal. That's the extensor carpi radialis longus. It does extend the wrist. So that's how you have to think of the wrist. Look at where the tendon goes. Can this tendon flex or extend any fingers? No. That's not your fingers. That's the palm of your hand. Okay. So it's only your wrist extensor. I'm just going to show you where it inserts. You know, could you identify the muscle? What's the muscle that inserts base of third metacarpal? Yeah, third one. So they're right next to each other. They're both wrist extensors, basically. And now we'll move on to the next three. The next three move the thumb. Okay, the first one is the Abductor Pollicis longus. And before I proceed, I should mention that, you know, movement of the thumb is different than other body parts. For the thumb only, pons. Abduction, adduction is in the sagittal plane. Now the reason why that's different, normally when you move things forwards and backwards, you know, like when you run, that's in the sagittal plane, but not for the thumb. Abduction, adduction is in the sagittal plane. Okay. In the anatomical position, your palms face forward, and look at your fingernails. These 4 digits, they're all in the same plane. However, the thumb, because of how it's positioned at a 90-degree angle to the rest of your fingertips. For that reason, abduction, adduction is like moving your thumbs forward and back, kind of like when you do sock puppets. It's movement in that plane, because your thumb is at a 90-degree angle to the other ones. So it's a little bit different. So it's kind of like, you know, yeah, moving forward, backwards, this movement, straight out, straight back, straight out, straight back. In the anatomical position, that's in the sagittal plane. That's what I mean. And for extension, flexion extension for the pollicis, flexion extension. Oh, and by the way, I know students struggle with spelling in anatomy. It's very difficult. We have a lot of words for you to spell. We'll practice that one. Please, practice flexion. It's not intuitive, right? What if you try to sound that out? I've seen that on tests. So practice the flexion for me, okay? XIOA, okay. So flexion extension for the thumb, it's movement in the coronal plane. in the frontal plane. Normally, abduction, adduction, like doing snow angels, that's in the frontal plane, right? But for the thumb, you know, going back and forth like windshield wipers, that's flexion extension of the thumb. Okay, so it's different for the thumb. You know, since I'm talking about abduction and extension here, I just wanted to make sure that was clear. Well, it's clear what this muscle does. This muscle is named for its action, right? This muscle abducts what? That refers to the thumb. Very good. And this is, the third term is a relative term. So you know there's a brevis, okay? Let's see here. So let's move on. The attachments. For the origin, I just kind of keep it simple. I say interosseous membrane for all of these muscles that move the thumb. Interosseous. It's a connective tissue between radius ulna in the forearm. CT membrane between radius ulna. And it's going to insert base of first metatarsal. Action, as I said, abduct. Pollicis.
Professor, I have a question.
Yeah. Go ahead.
I thought that the tarsals, the metatarsals were the foot, and the carpals were the...
Oh, I'm sorry. Gosh. Thank you.
You're welcome.
Metacarpal. Okay, pull this up. And we will use the same pictures. The origin is kind of right around here, between the radius and ulna. Okay. So the muscle identified up here, it's going to move the thumb. So identify the muscle somewhere here. The tendon will insert base of first metacarpal right around here. On some people, if you kind of like abduct your thumb, these tendons pop out. They used to call this the anatomical snuff box. But I'm staring right at my tendon. The tendons are easily viewed through your skin. Yeah. The tendon of that muscle you can see right here in the back of your hand right there. That's the tendon of Abductor Pollicis longus. There's also Extensor Pollicis brevis. And the longus brevis thing is confusing in the spelling. Longus is US, brevis is IS. So let's remember that. And we know what it does. It extends the thumb just by its name. Extends pollicis. I'll leave the origin the same. It's basically also interosseous membrane, maybe a little lower than the abductor. Maybe it starts down here a little more. But it's going to insert on the proximal phalanx of the thumb. So that is right, this bone right there. Good enough. And the last one is the Extensor Pollicis longus. Oh, I'm sorry. Before I erase this, let me put the correct insertion. And then I'll start fresh. So the insertion is proximal phalanx, digit 1, thumb. So you can put digit 1 or you can put pollicis. Don't put thumb. Thumb is not an anatomy word. Okay, it's kind of an everyday language word. So put digit 1 or pollicis. And don't put phalange. That's another common misspelling on the test. You think it's singular for phalanges, but phalanx is the proper mono singular word. Okay, I want to mark this wrong. I didn't mark it wrong on your last quiz, I think. I can't remember. I certainly will mark it wrong on any future quiz or practical. So, well, phalanx if it's singular, phalanges if it's plural would be better. Okay. So let's now do extensor pollicis longus. On models, you usually only see the tendon of it. It's kind of a deeper muscle. And sometimes I tag the tendon. So pay careful attention to what the tendon of the muscle is doing. And I just may have you identify the muscle through its tendon. So the extensor pollicis longus, I'll keep it the same, because it is, originates interosseous membrane. And it inserts, well, if you can guess, not the proximal phalanx, but the distal phalanx of thumb. Extends thumb. So it's going to originate here, interosseous membrane. It's grabbing some of the bones too, I'm just simplifying it. And it inserts distal phalanx of digit 1 right here. long tendon that pops out and goes all the way to the distal phalanx. On the app, I'm going to pull the shade down. Pull the screen down here. I have the first mover of the thumb, Abductor Pollicis Longus. And so basically, it moves the thumb. But look for the muscle, not on the thumb. Look for it on the back of the forearm. Look for that muscle to kind of pop out, kind of midway down, right around there. So look for it on models. Abductor Pollicis Longus. And look where it goes. It goes to the thumb. Well, it goes to the first metacarpal, which is not the thumb. It's the first metacarpal. I'm going to isolate this muscle. So it looks like in isolation. Again, just to zoom in. That insertion is base of what? Make sure you're awake. First metacarpal, not tarsal as I messed up. Okay, next muscle, right next to it, is an extensor. Extensor Pollicis Brevis. Okay, and that muscle, when you isolate it, it goes all the way to, well, past the first metacarpal to the proximal phalanx, okay, to extend the thumb. So abduction and extension are animated. Let's do abduction first, just to go back. Here's abduction of the thumb. Movement in the there it goes. Hold on. There it is. I'm trying to find the best perspective to show you. Not that, but that. Okay, moving it out. So they show adduction, abduction, so. Not that. That. It doesn't show it very well, in my opinion. I think I showed it better too. Well, I'm going to move back and show you extension. Let me see how they show us extension of the thumb. They show it kind of the same way. Okay, I'm not liking it. I give it a C-. Now they modeled it. What I don't like about these things, it's like they give it to the programmer. The anatomy is only as good as their programmer. And then they give it to me and say, this is what you need to show. And it's not always completely correct. But for the most part, I think this app is pretty good. Now, that third muscle, sometimes you can only see the tendon. That right there, if I could ever highlight it, my big fat fingers. There you go. That's the tendon of Extensor Pollicis Longus. This third one here. So it goes longus, brevis, longus. Abductor Pollicis Longus, Extensor Pollicis Brevis, tendon of Extensor Pollicis Longus, and it's going all the way to the distal phalanx to extend the thumb. All right, I'm going to move on. The last three muscles extend wrist and digits. Let's draw this one out. It's the extensor digitorum. This is what it looks like on the app. Go to our colors right there. All right, extensor digitorum. Basically, extends digits 2 through 5. Not 1, right? we talked about 1 just right now. There are 2 muscles that extend the thumb. So these will extend the rest of them, basically. And so it will extend all of the joints all the way out to the DIP. Or I should write that in capital letters. DIP, the distal interphalangeal joint. Last week I asked a half sheet question for FDS. I asked, what's the most distal joint this muscle can flex? And the answer was PIP. And a lot of you missed it, so I wanted to mention that in class as I was checking off your half sheets. The PIP would be correct. For example, right now I'm flexing my PIP on this digit number 2. Right now I'm flexing my DIP. However, this muscle cannot flex the DIP. It only goes up to PIP. And what I'm saying for this muscle, it can extend all the way out, so you can completely straighten out your fingers, because it has a tendon that goes all the way to the distal phalanges, the digits 2 through 5. It originates lateral epicondyle. So it'll insert the distal phalanges. That's digits 2 through 5. And if you want to get more specific, you should say, you know, pretty much on the back, the dorsal aspect. Okay. Now, sometimes students, a common mistake is you leave out digit. You shouldn't do that, because the digits are numbered, just like metacarpals. Okay, so because metacarpals and digits both have the Roman numerals, you should specify. All right, so originates up here, and it's going to insert way down here on the distal phalanges. Here's 2, here's 3, 4, here's 5. So we go all the way down there. The muscle is kind of a broad muscle. When it gets close to the wrist, the tendons kind of flay out, they kind of fan out as they go to each of their digits. So that is the extensor digitorum. And now the other two, the next one is extensor digiti minimi. It also originates lateral epicondyle. extends digit 5. I think the correct pronunciation is minimi, but I always say mini-me. It's more fun, I guess. But it has the same origin. It originates lateral epicondyle. And inserts distal phalanx of digit 5. So origin, way up there, the insertion, way down here, digit 5, pinky finger. It's a very slender muscle. It may even look like it's a part of the digitorum, but it's not. It is its own muscle. Yeah. Extensor digiti minimi. Okay, the last one. Oof. Extensor Carpi Ulnaris. Extensor Carpi Ulnaris. Now the extensor carpi ulnaris, it's on the ulnar side, it extends the wrist, but it still originates lateral epicondyle, so I'll put what I said first. Extends wrist, originates lateral epicondyle. And inserts base of 5th metacarpal. So look for it on the ulnar side. It'll originate here again. It's going to go to the other side over here at the 5th, base of the 5th metacarpal. It's a bigger muscle. So I try to draw it a little bigger than digiti minimi. So there's the 9. What's the 10th one that I already did? Supinator. Supinator. And going back to the app, practice the 9. Okay, the 3, 3, and 3. It's hard to do, like, standing here as a presentation. But always find that exception muscle, the brachioradialis. Always start with that. And if you've gotten down in groups of 3, it gets easier. Let me pull the shape down. Brachioradialis, Extensor Carpi Radialis Longus, Extensor Carpi Radialis Brevis. Then the three movers of the thumb. Abductor Pollicis Longus, Extensor Pollicis Brevis, and then the tendon of Extensor Pollicis Longus. Extensor Digitorum, Extensor Digiti Minimi, it's really slender muscle right there. And then Extensor Carpi Ulnaris. Let me show you Digiti Minimi by itself. It's very slight. There it is, all by itself. Extensor Digiti Minimi. If you zoom in, it's going all the way to the distal phalanx of digit 5. Some patterns, for example, let me highlight that first one. What I have highlighted is Extensor Carpi Radialis Longus. And remembering the whole longus brevis thing is easy if you know that it alternates. If you start with this one, Extensor Carpi Radialis Longus, then it goes brevis, then it goes longus, brevis, longus. Okay? So once again, Extensor Carpi Radialis Longus, Extensor Carpi Radialis Brevis, then Abductor Pollicis Longus, Extensor Pollicis Brevis, and the tendon of Extensor Pollicis Longus. So that's another thing. The longus brevis, it alternates. Well, I mean, it's just it'll just take time. I want to take a break now. When we come back from break, I do want to start teaching the nerves of the brachial plexus. So a little more lecture when you come back from break.